set out to gather input from parents and CNC staff to inform program planning and enhancements for CNC. And really what we wanted, we were looking for data on how CNC programs currently are helping newcomer parents, what are the primary challenges of newcomer parents, and how we can improve our programs to better meet those needs. We also wanted to identify any assistance and supports that newcomer parents currently feel like they're not receiving that we might be able to assist them with. For the purpose of today, we're going to talk mostly about the input that we received from newcomer parents rather than the CNC staff. In terms of methodology, there were 97 participants informing the findings of this report. Input was collected via 4 focus groups in Hamilton, Mississauga, Halifax, and Toronto. There were a total of 34 parents that participated in those focus groups. There were also 3 private interviews completed with the facilitator by parents in Halifax, Toronto, and I think one in the GTA, I can't remember where. 60 CNC staff also participated. There were 4 private interviews with the facilitator. Again, I believe somewhere out on the East Coast and interspersed around the GTA. And an online survey was distributed to CNC staff across Canada. So nationally, there were 56 participants who responded to that survey. So the summary of findings, what we found actually wasn't all that surprising. It was something that we suspected, but we didn't really have any idea of the intensity with which we were going to hear what we heard. You can go ahead and switch it. And that was alone. Alone was it seemed to be the word that best described both the emotion and the primary challenge of parenting when people first come to Canada. The reality of being alone, with no family and no others to support them, sometimes with no others who speak the same language of them as the family. We heard it over and over again in every focus group and in every interview. This is what came up over and over for the parents. For example, you can just switch the slide. Let me read to you some of the quotes directly from the newcomer parents. "You're by yourself, nobody is here, we have no family. I have no family here, just my husband and baby. I need help and someone to help, and my husband has to work, so being alone is very hard. We're used to family helping us." Especially with new parents, when it's their first child. Oftentimes they're used to having a support network around them, and it's just not, they find that it's just not here. They told us that they feel especially alone in parenting situations and in times of medical crisis situations. Next slide, please. Beyond alone, these are some of the other things that parents talked about. They're concerned about access to affordable childcare. They're challenged by the lack of knowledge and lack of language. And by lack of knowledge, it was things like, I came to Canada, I didn't even know where to get diapers. I didn't have access to that kind of information. And even though there's paper documents out here that I might have access to, I need someone to help me and help me figure out what it is that I need even. Behavior guidance was something that came up mostly in responses from CNC staff. They find that parents are challenged by some of the rules and regulations and laws here in Canada around child abuse and behavior guidance. Mental health was a concern, as well as just a general lack of support and relationships. So this kind of gives us a current read as to what parents are needing and looking for. The evidence showed that newcomer parents were clear about the fact that they didn't need more written information in our study. They weren't looking for more written information, they were looking for parenting information and workshops, a chance to talk and for someone to listen. Someone to guide you, advice and someone to talk to, someone to explain, someone to tell you. Again, you see over and over again, they're looking for that someone to combat that alone, someone to fix that and help them with that. Next slide. Also of note was the fact that in every single focus group, more than one parent brought up situations of medical crisis where they were extremely challenged by either a lack of knowledge, lack of childcare, lack of support, lack of knowing where to go and what to do, or just not understanding what was going on. These things came up over and over again. And the emotions around that were also evident. So you're scared, you're alone in the hospital, how do you explain to the nurse? I have a quote here too, directly from our parent. I have 2 kids with 1-year age difference. One went to the hospital and the other stayed with me. There's no place to put the other kids. I had to stay in the hospital for 2 weeks with both kids. This is very new to me in Canada. I have no friends to help. Another parent talked about a time that her daughter fell and hurt her arm. Her husband wasn't available. She tried to call 911, but she couldn't explain. They sent an interpreter, and she just felt very alone. And back home, she felt like she could have handled the situation, and here she just felt completely unable. Another emerging trend that was identified by CNC staff rather than parents was the incidence of single parenting, and not single parenting because of divorce, but single parenting because one parent is out of the country working for long periods of time and leaving one parent to parent alone. So this is another trend that seems to be, I mean, again, it's not new to us, and many programs have been seeing this for a very long time, but more than once it was brought up numerous times that programs were seeing a rise in this happening, and it's contributing to those feelings of alone. Those are some of the global problems that were brought up by parents in our focus groups and interviews and study. But let's talk a little bit about how CNC seems to be helping. Thank you. So CNC seems to be doing a good job, we were happy to say, in commenting some of that alone. CNC is a relationship building experience that does provide an opportunity to lessen the loneliness. Again, remember that in CNC there are more opportunities for interactions between the caregivers and staff. So parents were saying things like, they treat us like family and they know every child by name. Teachers are just like mom. It's a social environment and feel like a family with the parents and teachers. CNC is a great place to get information to parents. In fact, it's one of the requirements that they have to provide information to parents to support their settlement, the family settlement. So this was nice to hear that seems to be working and providing parents with some assistance. Parents were telling us that they have confidence in the qualifications of the staff, and they already see that the staff is capable and good with the children and motivate the children. And we see that sometimes the day-to-day small contacts can make a really big difference and be exactly what they need or maybe not rather than the one-on-one counseling sessions. Some people still need those as well, but for a lot of parents, those one-to-one everyday interactions with someone that they have learned to trust and treat as family is really helpful. So implications for programs. What does this mean for programs, I guess? Based on some of the parent feedback and suggestions, we definitely see areas of strength in our programs, but we definitely see areas that we can work on to do better and to even better support growing families. Next. Parents said they needed crisis and intervention and personal issue support. Solutions with personal interactions, not written information, parenting workshops. They definitely were very clear again about not needing more written information. They will want the person-to-person interactions. They want all of these things, and yes, they're saying that they know that there's information online and there's pamphlets, but they really want someone to walk them through and use those the documents and the online research and support, walk them through that support and help them to access what they need. They're saying that I'm alone and you feel like family to I'm alone and you feel like family to the CNC staff, which is great. But as an organization, we'd like to look at that and figure out how can we really capitalize on that and do a better job of supporting them still. There are definitely lost opportunities, and there's expertise in the childcare programs that we feel like we could tap into. We would love to see more of a connection and communication between the settlement workers and the childcare staff. And in some programs, for example, the program that we saw at the beginning in the little documentary, it looks like they're doing an incredible job of integrating the two, and that's what we want to see more of. We want to see the settlement workers passing along information about community supports to the CNC staff so that they can then distribute it and support parents in accessing those things. We also would love to see the CNC staff feeling connected enough to the settlement workers that they're better able to identify people who are needing more one-on-one counseling and services that way as well. So we would really love to see more of that connectedness. I do have another quote here. Oh, and I guess I should mention that multiple parents did speak in focus groups and interviews about the idea of a parenting center would be fantastic. There's a place where you go when you need a driver's license or you need anything to do with driving and transportation. And there's a center for different things, but there's no parenting center is what they feel like. There was nowhere that they could go that they could get everything they needed to know about their children. We have quotes like, I had no English at all in the first year and nobody with my language was near me. Now I know there are lots of free services, but nobody told me. And this we hear over and over again, that families are going long periods of time here in Canada without any support network, and not even realizing that right across the street there might be some services that they can get access to. So just as a group and moving forward, how do we figure out as a society how to avoid that and make sure that families are getting access and knowledge about these programs when they first come to Canada? Another parent said, you need some place to go when you come with information and to tell you information about everything for your child. We know nothing. So there are places here in the city, there's lots of places for people to go, but making those connections is really important. And we'd like to see more of that happening in our programs.